All right, hello there. We're here today for our knee evaluation video. So first of all, I'm going to start by getting a little history of the athlete, kind of see where we're at with our present condition today. Um, First off, let's start with your name.
I'm Josh.
Josh, nice to meet you, Josh. What brings you in today?
So I was playing. I was playing the other day, and I came
Playing what? Sorry, let's start with sport.
soccer.
Soccer, okay.
Yeah. So I was dribbling the ball down the field, and I tripped and I fell like right on my left knee, and I didn't hear like a pop or a crack or anything like that. It just kind of swelled up, and it just was like really painful.
Okay. Were you bumped by anyone or made contact, or you lost your footing and then fell?
Yeah. So I was dribbling the ball, and I tripped over the ball with
Okay.
my knee.
And you landed how? Like directly on it, on the front or the side, or how exactly did you land? Do you remember?
Yeah, so I fell and just like directly
Just
on top
right
of my
on.
knee.
Okay.
Yep. Yeah, like right on my kneecap.
So what area is bothering you the most right now? What's giving you the most discomfort?
Just like right over my kneecap, like right on top there.
Okay. Right in here.
Yeah, so like right there really hurts to just touch.
So when you say really hurts, what's a pain scale like for you? If 1 to 10, 10 being the worst pain you've ever felt.
Probably say a 7.
A 7.
Mm-hmm.
And what's that pain like? Is it more dull and achy kind of, or is it pretty intense and sharp still at this point?
Yeah, I would say probably more dull and achy.
Okay.
Mm-hmm.
Okay. About a 7. And you said no pops or cracks. You didn't feel or hear anything when it
No,
happened?
no, I didn't.
Okay. Is this your first knee injury you've had?
Yes.
Okay. So no, nothing with the other side or with your left knee as well.
No, this one's great. It's just my left knee.
Okay. Okay, right on. I didn't catch you walking in, but I didn't notice did you have a limp or anything like that? Were you kind of guarding it a little bit when you walked in?
Yeah, so it hurts to just do this with my knee, so
Just
I try
moving
to,
it?
yeah, I try to like limit my knee movement over here as much as possible.
Okay. Yeah, because I can see let me roll your pant leg up actually really quick. I think we're pretty swollen, right?
Yes.
Okay, yeah. You got some swelling right over the top here, okay. A little bit discolored. Okay. So you've no previous knee injuries, you said. This happened when exactly? Was this yesterday or?
This was yesterday.
Okay.
Mm-hmm.
And in a practice, you said, okay. All right. Let's go with, let me see your other knee as well too, actually, really quick. Just have both, I just wanna kinda compare. Both equal this way. Yeah, definitely more swelling on this side. Okay. Just right over here, right over the patella, huh?
Yeah, like right on top.
Nothing over on any of the sides?
Mm-mm.
Okay. So we'll go into a little palpation now. At this point, we're gonna start with the quad area. Any discomfort up there?
No.
No? VMO,
No.
anything there? That's okay. How about MCL?
Nope.
Nothing, no problems there. LCL too, that's okay to touch?
Yeah.
Okay. How about right on the patella, you said is sensitive, right?
Yes, that hurts.
That's the most painful?
Uh-huh.
Okay. How about your patellar tendon?
It just kind of hurts, but
Little
it's
sore.
just up here.
Okay.
Yeah, doesn't really hurt on that.
We'll check that tuberosity, nothing down here?
No.
Okay. Right in there. Alright, at this point, based off what I've kind of seen at this point with the swelling and the point tenderness right on the patella, some differentials that I want to check out and rule out at this point are definitely want to rule out an ACL or PCL type injury. I believe that our MCL and LCL are intact and okay at this point, but I'll probably give him a test just to make sure there's no discomfort. But also another differential that I want to check out a little bit more is prepatellar bursitis as well. So we'll get into that right here. Also at this point, I will have the patient do an outcome measure tool, trying to get a little more accurate assessment of how they're feeling and what a little more in depth of some day-to-day activities of how they go about it and pain level and things like that for them. So now at this point, I want to have you, can I have you lie down? Just, you can have your head on that side, yeah, and we'll slide you over here, perfect. So from here, the first test I want to do, actually, let me have you slide back just a little bit. We'll get in the camera a little bit more. First one I want to do is a sweep test. So we're just going to kind of milk, get a little of that fluid moving. I'm sorry if this is uncomfortable. So we do have that swelling still in the area, but it's not moving like what would show on a positive sweep. From here, we'll go into the anterior drawer. Be about here, nice and relaxed. Get that's intact. Posterior drawer. Good, both firm endpoints. That's good. Okay, from here, we'll do a little valgus and varus stress. Just make sure, double check on those MCL and LCL. Good. Good, both have firm endpoints intact there. Really quick, I'm just gonna grab something to stabilize the athlete's leg. Let's use this makeshift foam roll here. Maybe. We'll kind of stabilize up. I want to do a Lockman's here, try and relax the athlete as much as possible. Okay. Again, firm endpoint, not worried about the ACL with that. I'm going to go into a little bit of range of motion. I know the athlete was uncomfortable with some movements, but I just want to see what his comfort level is like with some flexion and extension at the knee. So I'll just guide you up into a little bit of flexion. That's a little bit uncomfortable?
Yeah.
There, okay. And how about here, straightening out, extension?
Yeah.
Right at the end there a little bit?
Yeah.
Okay. From here, I want to do a little bit of joint play with that patella in particular, kind of see how much movement we're getting. It's going to be an indication of how much swelling really is in the area and what structures are affected as well. So we'll do a little bit of medial and lateral patella joint play. Not a ton of movement for the athlete, and there it is uncomfortable because of all the swelling and pressure in that area. We'll check the other side too, just to compare. Yeah, definitely much more patella movement on that unaffected side, so that is a little bit of cause of concern right there. One last one I want to do, just to rule out a dislocation of the patella or anything like that. We're going to do a little apprehension test with that patella. So we'll pull it to that lateral side. Again, not a lot of movement with that patella, but I'm not concerned about any subluxation or dislocation of that patella based on the movement. Athlete is still pretty relaxed, so I don't think there's a cause of concern for that. But again, not a lot of movement with that patella itself. You can go ahead and sit up, actually. We'll be done. Thank you. Based off the tests and some findings we've had with those results, I don't have any concern with his ACL or PCL. I think the MCL, LCL2, all the ligaments are intact, firm endpoints. At this point, I am going to diagnose prepatellar bursitis, though, based off all the swelling and pressure right over that patella. That impact and the mechanism would make sense, striking down and rupturing one of those sacs there in the knee. There's no need to refer to a physician for an injury like this, but we will try and rest the athlete as much as possible to try and control that swelling and reduce the discomfort. So with rest, we're gonna have probably a compression wrap as well, treat it with ice as well, that'll produce swelling and discomfort. Also anti-inflammatories such as ibuprofen would be good in this situation. Once we've kind of controlled that area and controlled our swelling and discomfort in the knee, we will, the athlete will be able to return to play and be able to participate fully, but I do want to get him on a little bit of a rehab protocol, get some exercises to kind of strengthen around the area, as well as increase some range of motion that may have been lost with the swelling and everything as well. So that's where we're going to go forward from this. That'll be it. Thank you.